Hello and welcome to the Headache Doctor podcast, where on this podcast, it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. In today's podcast, we're going to talk about the most common presentation for a migraine and why that presentation points to it actually being a neck issue. I think this is going to be an interesting topic because we're going to capture a lot of you guys out there that are having some variation of the symptoms we're going to talk about. And it's going to help you understand and dissect, okay, like why would it make sense that this is a neck issue? And so if you don't hear your specific story in what we're talking about, meaning like if your symptom presentation is slightly different, don't worry, because this podcast will still hit on some overarching themes that are helpful to understand as anyone with a headache or migraine trying to navigate our healthcare system. But specifically to the individual that has been dealing with migraine symptoms for a relatively long period of time. I mean, it could be a few months and you've tried to get a diagnosis, been to providers, haven't found an answer. Oftentimes it's going to be years though, maybe even decades. So a long time. A lot of our patients, they've started, they note the onset, the initial migraine was when they were a child, and now they're in their 30s or 40s or maybe 50s, something like that, okay? Now, a typical migraine and what the diagnosis is actually comprised of are just a series of symptoms. Those symptoms being one-sided, debilitating, pounding, throbbing, pain that is associated with sensitivities to lights and sounds, nausea, and maybe a visual disturbance or an aura, something like that, okay? So you have the pain itself, and then you have the associated symptoms, and those associated symptoms are what often are putting this in a category of like, oh, there's something neurological going on, because it's not just pain. And then the fact that the pain's in your head, that it's debilitating, that it's pounding, throbbing, that it feels like pressure. Those are things that they make it confusing and difficult to understand. All right, but we're going to break it down and come to the conclusion that your neck should be evaluated. Okay, so just as a disclaimer, this is a podcast you're listening to. I'm talking based on my experience and generalities, but this is not intended to provide you with your diagnosis. Now, our healthcare system is not necessarily set up to capture the neck problems that we're seeing, and so feel free to reach out to us, and we can provide you with a proper diagnosis here in person, in office, or we can help direct you to maybe an avenue of care in your area, or maybe we can just go through our coaching program and coach you through lifestyle changes and a healthy direction so that you can start actually finding true relief outside of medication. But what I want to talk about today are the symptoms that surround the most common presentation of a migraine. All right. So first off, there's this sense of intermittent pain. So a migraine, as far as the patients we work with, it can last maybe on the short end, it's like 20, 30 minutes to an hour, something like that. And then on the long end is multiple days, at least 24, 48 hours, something like that. And then we have people that state their migraine has sort of just like never ended. So they used to get them intermittently, and then it just goes on forever. But we're going to talk about the intermittent pain. So there are days where you feel fine, you feel good, and then there are days where you have debilitating symptoms, okay? And the migraine will hit. It could be in the morning, could be afternoon, evening. It could be random. There may not be a pattern to it, but there's days where it's good, and then there's days when it's bad, okay? And so that's the first thing. The other thing we're going to talk about is the one-sided presentation. So why would it be one-sided? What's going on here that's causing a one-sided pattern of pain, okay? Even if it's debilitating and there's like an ice pick, or it's pounding, throbbing, or the intensity is just so bad, why would it be one-sided, okay? We're going to talk about why neck pain would be associated with over 60% of migraines. People with migraines also say that they present with neck pain, neck tension. during the migraine. Okay, we're going to talk about why that would be. We're going to talk about why nothing else is found when it comes to actually understanding the underlying source of the migraine itself. And okay, my head hurts, my eye hurts, nothing's found in these areas. Okay, what does that mean? All right. And so we are going to break these things down, and then it's all going to point in the same direction. And it's going to be a direction that says, hey, there's hope and there's encouragement and there's something that I actually can do to start taking control of my health again. All right, so first off, intermittent pain. So intermittent pain, good days, bad days, what we see is this cycle that the migraine will kind of function within. And it's a cycle that gives us insight into pain threshold, the brain, and then also the actual tension that our body's carrying. So think of each day of your life as being comprised and of multiple scenarios, lots of different scenarios that either increase or decrease stress. You give the body the movement it wants, or you're adding stress to it. Most of the time, we're finding that people are overloading their body with things that are stressing it out physically, okay? And that could be a lack of movement. That's one of the most common ones. Prolonged sedentary positioning, desk jobs, things like that. Or it could be repetitive movements that maybe the body's not conditioned to be able to tolerate. Maybe it's that you are actually physically fit and exercise, but you're asking your body to do more than it can handle. And maybe you're doing overhead press and shoulders, and you're putting your neck in positions that it's really having to strain to hold your head up. The idea is that your body doesn't feel everything that is a stressor or that increases tension in the moment. So your body's able to tolerate, compensate, cope with a certain level of stress that you can ignore. You can go through your day, you can go through your life for a period of time and you don't feel anything. You feel fine. You're not aware that there's any problem at all. All right. And so what happens is that stress each day, each activity, the lack of activity, the level of tension that's running through your neck, the body's able to tolerate it, and it tolerates it, and it tolerates it. Okay. And then it hits a point where it says, okay, like I'm done tolerating this. And that's when you experience a migraine. So it's cyclical, right? So it crosses that threshold, it peaks, the day's terrible, you lose the day, it's debilitating pain, life has to stop, and then it resets. Your body forces you to go to bed, take a nap, avoid bright lights, loud sounds, strong smells, like it just can't tolerate anything else. It gets its break, it resets, and then you're right back into that cycle, okay? For some people, that cycle is longer, maybe every month, and some people it's shorter. Now, that cycle can also be impacted by threshold. So think of the hormonal migraine, which is once a month, and your estrogen levels drop, which corresponds to the threshold that your body has. So hormones impacting threshold, gut health impacting threshold. Anything systemic like inflammation running through your body impacts threshold. Even stress levels impact threshold, okay? So we've got the tension increasing, and then we've got things that are impacting your threshold. And when those lines meet and they cross, that's when you are basically more vulnerable, or you're experiencing your migraine, okay? Now, the level of exposure to all those different things and those stressors in your life, and that equation will either mean that you have like almost a daily headache or migraine, or you have like this cyclical once a month type of scenario. All right, so intermittent pain speaks to there being things that you can control, is my point. It speaks to there being tension that builds, and you may not feel it. It doesn't mean your neck is fine when you don't have a migraine and then it's all of a sudden like a problem. That's not what we're talking about here. And so your neck always is going to have issues. That's what we see with patients here. There's always tension underlying, and that tension builds and it crosses the thresholds. You realize what's happening, right? It's not as if it's just there when you have a migraine. You realize that it's there when you have a migraine, and then it drops down below that threshold, cycle continues. So it points to cyclical things that we can control, right? And it doesn't have to feel like, oh, I understand it, and it's this thing, and it's when I sit. It can be totally random, and that's because we have all these different variables going on. And it can be really hard to understand your trigger, even if it feels mechanical, but you're just like, yeah, some days I sit at the computer, I'm fine. Other days I'm not fine. Or some days, I'll sleep funny and I'll wake up and I'm fine. And other days I'm not fine. Like yes, there's lots of different factors at play here. All right. The one-sidedness of the pain itself is also going to point to the neck. All right. So there's something called a cervicogenic headache. I've talked about in this podcast. Go back and listen to that one. It was probably a couple years ago. But cervicogenic headaches are basically headaches that stem from the neck issues. The neck is the actual source of pain, and it travels, causing a headache or head pain in a one-sided presentation. The one-sided presentation corresponds to that side of the body. Neck in particular, can be shoulder, can be jaw, but one side of the body having a pain signal and being more aggravated than the other. And so it's driving those symptoms. So oftentimes the migraine will be dominant on one side. It's not uncommon for people to only have a right-sided presentation or only have a left-sided presentation. But it's also not uncommon for people to have it on both sides, like it'll flip-flop. But one side will be more intense. Or they could have pain on both sides every time, but like one side feels different symptoms or more intense, or it's behind the eye on one side but not on the other, things like that, okay? So when we think about what we actually know can cause a one-sided presentation, we think of cervicogenic headaches. Now, if we're going to take the opposite stance here and defend a chemical origin or a neurological origin and say this is just the brain making stuff up, I would argue that if the trigeminal pathway is the thing that's just the brain saying this is painful, you would get a bilateral, both sides would be irritated, okay? And it would be more global as well. Like if the brain was having just a spontaneous neurological event, if there was a sort of a dysfunctional response to or release of the CGRP, like the proteins that transmit pain or serotonin levels or something like that at the chemical, neurological, neurotransmitter type level, it would be more global as opposed to like a specific nerve or a specific presentation or the ram's horn presentation, okay? But we don't necessarily see that. We see a one-side dominant pounding, throbbing sensation. And oftentimes it is in this ram's horn presentation. Like it starts in the back, wraps forward, or it starts in the front and wraps backward, okay? So it's like connecting to the neck to some extent. And then the neck also can hurt. Like people say they have that sensitive spot, which we'll get to that in a second. I'm getting ahead of myself. But basically, a one-sidedness points to a mechanical issue more so than it points to a spontaneous neurological event. And it points to a mechanical issue being the neck, jaw, shoulders, anywhere that can refer pain into this pattern. And cervicogenic headaches refer pain in the same pattern. It's a referral pattern that we're very aware of because we have this diagnosis of cervicogenic headache, and it's something that providers should be aware of and testing for. And our testing for the neck is just not sensitive enough. So we're catching, like most everyone that we see, we're catching a referral pattern from the neck that we're able to reproduce even the first visit. And it's like, okay, like here's the thing that's sending the signal. And we didn't have to do an MRI. We didn't have to do an X-ray, CT scan. We didn't have to do an eye exam. We didn't have to look at your ear. We just pushed on a spot in your neck that's super sore, and we don't even have to push that hard. It's just like, oh yeah, does that hurt? Oh yeah, that hurts in my head. And I've had this for 2 decades and no one's ever done that. And it's just like, okay, well, we have something that's directly reproducing your headache or your migraine. And so we need to treat that and we need to get that better. Because if we don't get it better, then we're just like assuming something else is going on. You're continuing down this sort of medication. So it feels appropriate to go through a conservative treatment of physical therapy in order to restore function to the neck. And sure enough, when that spot calms down, the pain in your head also calms down. That's what we see over and over. Okay, so neck pain is also associated with migraines. About 60% of people, give or take, will say that they have neck issues or neck pain associated with their migraine. Okay, so this is kind of like chicken or the egg. So if you look at anyone, I guess if you Google or look into the opinions of like how they're evaluating, how our Western medicine model, like a neurologist or something like that, is evaluating, okay, the neck hurts, they would say that's a symptom of the migraine. Okay, so the brain, the neurological dysfunction, spontaneous neurological event is like driving the thing. Like that's what we need to fix. And because that is causing these other pain signals and sensitivities, the neck hurts, right? And they would say, well, it's all traveling under the same pathway, and there's like a common signal that's sent to the brain, and it's sensitizing all of these like nerve bundles that meet up in the brainstem. And that's why. And that's something we talk about on this podcast all the time. But what's assumed there is like their neck is fine, and their neck isn't the thing sensitizing everything and causing the pain signal. It's the brain itself. But what we're finding is the neck is not fine. The neck is actually very angry and very mad and sensitizing the other pathways that are involved and referring pain so that the brain thinks something's wrong. And we want that. Okay, we want that, because if this is just like a spontaneous neurological event, then yeah, like we're just stuck taking meds that are oftentimes not even that helpful and have side effects like forever, or for as long as we have the migraines, till our like late 50s, early 60s, something like that. And so we want there to be a missed neck problem, because that's something we can actually treat. So the neck pain associated with migraine is actually giving us insight into like, oh, like maybe there's a neck issue that we're missing, and we need to continue down that road. And then lastly, we are in our healthcare system are very good at catching the things that are visible on imaging, that are scary and going to potentially be life-threatening, things like that we worry about, that seem to actually match with how bad these symptoms are, right? Like it's like my head is going to explode, and so let's figure out why my head feels like it's going to explode, because I need a head to live, right? Like that's a very logical way of thinking through this, and it's like I need to go to the ER, and this is terrible, especially if it's new. And that's actually, if you have a new headache that feels that bad, you do need to go get it looked at acutely. But what we're dealing with are people that have been, managing their migraines successfully or unsuccessfully for years or decades. And they're just like, either I'm done managing it with meds, or the meds don't work, or whatever it is. And they've been to multiple doctors, neurologists, they've been through the scans, they've been through the tests. And our healthcare system is very good at catching those things, right? And so instead of saying, oh, we didn't catch anything that's life-threatening, and so the medication works, and because the medication works, this is like a serotonin problem, or this is a problem that needs medication. That's sort of like cyclical reasoning. Like we're giving a medication, the medication wasn't even intended for that, but it seems to help. And so it's like, oh, well, maybe since we're manipulating neurotransmitters or serotonin, or we're manipulating these CRGP peptides, like we're doing something that is actually telling us what's at the source of this, when all those things are really just their responses to pain, they're normal signals that are sent through the body. They communicate things to the brain through the neurons, through the nerve pathways. And so instead of just saying like, oh, like the brain thinks something's haywire, and stopping there and prescribe medication so the brain calms down, we should look to say like, what is actually causing the brain to go haywire? Just because we haven't found it doesn't mean it's not there. And imaging is of the neck is something of value, but it's not the full picture. And so if we're missing a reasonable explanation for like sending these signals, causing these symptoms, and it's especially something as conservative as like when we go through coaching, a lot of it is telling people, making them aware of the things that are in their life that are increasing tension and stress and part of the problem, and then allowing them to make changes, and then they're just living a healthier life and they found more relief than they've ever had. And that's an amazing thing. And it's within the grasp of you to make changes and then start down that journey. And that's why we have this podcast, and that's why we have reviews on this podcast that are like people saying that this changed their life. And a lot of these people I don't know, I haven't met. And you listeners out there, I super appreciate. The only way I might make money off this podcast is you heard the ad on the front end with the SAM device, which is my effort to make this sort of treatment accessible. Just so you know, the SAM device, if purchased, is a component of what we do. If you get it and you're like, man, this is confusing, just give us a call. We can help explain it. But if it's like, we have a lot of people that are like, man, like this thing really super helps me. But it's a component of what we do, and it complements what we do. And so if it works as a standalone and it's helpful, like please let us know. We'd love to capture your story and share that. And but it may be something that gives you insight into this being a neck problem, and then we're able to partner with you to go through the full process. But anyways, my point is that I'm passionate about this because it's a problem, and it's a problem that I want to see fixed in our healthcare system, where it's accessible, it's attainable. It may not feel like it, and I'm not trying to offend anyone by oversimplifying something, but I've just seen it work over and over again with very complex situations that if we simplify this process, make it digestible, make it make sense, and you can take that to heart and take action in your own life, whether that's working with us, making changes in your life, going through coaching, like these things that are conservative. We don't do, and we're not doing surgeries here. We're not doing injections. Like we barely, if ever, are using imaging. And so it's just putting these principles in place and seeing them take root in your own life, improving your physical health, and then understanding how these other factors play into it, finding providers that can complement that, and moving forward with you having more control over your situation. So there you go, the most common presentation of a migraine and how those symptoms can point to the neck. Thank you guys so much for listening to the Headache Doctor podcast each and every week. I've realized in September I've been doing this for 5 years and I haven't missed a week. And so I appreciate y'all for being dedicated listeners. Please share, like, subscribe, send this podcast out to anyone who you know would be helped by it. Thank y'all so much as we continue on this journey to educate and empower everyone with headaches and migraines so you can break free from a life of fear of your next headache or migraine and dependence on medication. I'll see you next week.